Hi, Aniko. Welcome to the podcast.
Hello, Emma. Thank you for inviting me. I'm very happy to be here with you.
This is a topic I'm very, very passionate about because I've also had some problems over the years with strain and pain in dentistry and invested a lot of money in going to see my therapist and physios over the years and ergonomic loupes. So I'm excited to pick your brain because you've been teaching in this niche in dentistry for a while now. So I'm interested to hear what you have to say and also share it with everyone else. So please tell us a little bit about your journey to optimum dental posture. What led you down this path?
Well, similar to you, Emma, I had been suffering chronic neck, back, shoulder pain, eventually even hip and sciatica radiating into the leg.
Oh,
All my practicing life, even as a dental student, I was already in pain.
wow.
And over the years, like you, I went everywhere. I tried every kind of medical specialist, physical therapist, you name it. And all I got was just short-term symptom relief, which didn't last long. And I was desperate. There were times when I couldn't even tie my shoelaces. I was in so much pain and I had to cancel patients. And on the verge of forced early retirement, I stumbled upon the inner ergonomic principles of what is called the Alexander technique, which is virtually unknown in the dental field until I started promoting this work. Dental specific application. It was available for a long time for mainly for performing artists and musicians.
Oh,
And yes, so there is such a thing as playing related injury among musicians and um, various areas. As soon as I came across this work, I realized that unless we deal with the cause of the problem, which means knowing that there are certain joints that are not designed for prolonged bending, as we do in dentistry, and there are certain muscles that are not designed for prolonged contraction. And clearly, no amount of symptom relief was going to help unless I learned to change what I was doing that causing me the pain. And so what led me to do what I do was that I realized that I need to train, and I spent over 1,600 hours in person over 4 years part-time while I'm
wow.
practicing dentistry and to train in this. And then I spent probably another few thousand hours translating that into dental specific application. And then because I'm so passionate about helping my colleagues, the clinicians in dentistry, because I suffered for too long and I know what it's like. So that's how I came to start Optimum Dental Posture and run training programs and lecture and do what I can do to reduce the risk of occupational chronic pain in our profession.
Wonderful. I remember thinking just a few years into dentistry with a sore lower back and neck strain, I remember thinking, is this going to be my future? Is this going to get worse? So I was quite anxious at one point in my career, and this was before I'd incorporated lifestyle changes and, training at the gym and different types of things. But for students and new grads, I've had a few reach out to me and they say, I'm already experiencing pain in dental school exactly like you went through. So I guess what I'm asking is strain and pain inevitable in dentistry? Do you think every one of us at some point is going to experience some sort of discomfort, or is there a way that we can completely avoid that?
This is a brilliant question, Emma. So I can't say that we can totally avoid any discomfort because dentistry is physically, mentally, emotionally demanding. And the physical, mental, and emotional parts of us are connected. And
Correct.
so you can have brilliant posture and then suddenly Mrs. Smith, who is always losing her temporary crown, or somebody else gets squeezed in and, or yet again has a problem. And immediately there is this rush of stress hormones and then everything contracts and then we are uncomfortable. And also all day long working the way most practitioners do, it is tiring. However, there is a certain amount of pain and suffering that comes from trauma to the body when we're doing things we're not designed to do that can be avoided. And that's really where I focus, as well as I teach clinicians that I train, and I often train the whole dental team, including the dental assistant, the receptionist, everyone. I go out to practices on how to take what's called the active rest, where you're actually resting all your joints and muscles and everything for a short lie down. And it's a special kind of lie down, and we might get to talk about it. But coming back to what you said before, and I'm going to just do a tiny demonstration for the audience when they watch this. I remember practicing for years where I had burning pain in my left shoulder after my second patient on a Monday morning, and I was resting all weekend. And I used to work with my shoulder up, elbow up on my non-dominant side. I'm right-handed. And by the way, most practitioners, most clinicians who are right-handed or left-handed, on their non-dominant side, they have the same problem. And so no amount of massaging, which is what all different doctors and physical therapists were doing, was going to help because, and this is what I want to start talking about, the muscles that move the shoulder and arm are movement muscles. They're not designed for prolonged contraction. So doing this, of course, I was going to be in pain. I'll just move across. If I said to you, do this all day, or even just for a few hours, you know you'd get a sore shoulder.
Yep.
Okay, so for example, just having the shoulder raised, and most practitioners do that, and the elbow up, and also not having a finger rest where you can literally park and release the weight of your arm onto a tooth, the same way that we always have a finger rest with our operating hand on the dominant side. Unless you do that, you're holding up a 4 kilo plus arm against gravity using muscles that are not designed for prolonged contraction. So that's the kind of injury and trauma, and it's called cumulative trauma. When we do something our body was not designed to do, and most people don't know that there are certain road rules and right and wrong gears to drive our body in, but we don't learn it. Imagine if we learned this in dental school.
I know, I wish we did.
That's absolutely. And something else, Emma, that really surprised me when I started running my workshops and training courses. I expected the older generation to come to me. My courses are filled with very young dentists, some of them hardly out of dental school, and they're in pain. And I've got two main reasons, or three, why I think this is happening.
Wow. It's quite interesting that it's a good thing that it's a lot of the young generation coming in to see you. But like you said, you'd also maybe initially think that it would be more seasoned practitioners. So that's quite interesting.
Yes.
And I also wanted to ask, a few years ago, I was temping at a dental practice, and the other hygienist, she was wearing this almost like contraption, and her arms were strapped in, and there were straps over her shoulders, and I'd never seen anything like that in my life. And curiosity got the better of me. I ended up asking her politely, just because I was wanting to know, and if it was something that dental clinicians needed to be aware about. It was a posture corrector. What are your thoughts on these wearable posture correctors?
Right. I'm glad you asked me this question, and I get this a lot. So here's the problem, and I've already talked about the fact that some muscles are designed for very short contraction. So movement muscles are designed to move a body part and then stop. Then there are deeper postural muscles that can fire, they slowly fire. They can go for hours and hours without fatigue. So along the back, there are some deep postural muscles, and then there are several layers of superficial muscles, movement muscles. And these movement muscles are, once again, not designed for prolonged contraction. And what these wearable posture correctors do is they activate the movement muscles, the wrong gear. Okay, they're not actually teaching. They're the muscles that when I train clinicians, I train them to deactivate the movement muscles that should not be firing and activate the postural muscles that are designed to naturally hold you up and avoid the trauma and fatigue. So I don't recommend them at all.
Okay, that's good to know, because I feel like, maybe, well, I didn't go out and get one, but someone else who maybe would see one would think, oh, I think I need that too, and just go out and buy one on Amazon or eBay
Yes,
without really understanding what we're supposed to be doing and what it's actually inhibiting. So thank you. That's really good to know. And I guess, coming off the back of what you were speaking about previously, I think it would be amazing just to have some practical tips for everyone to avoid compromising your posture in the dental surgery. I would love if you could share a few of those with us.
I would be delighted, because this is why I do what I do. Any opportunity I have to send this message. So what's important to know, and I'll go through a few basics. So
Thank
most
you.
people don't know, it's my pleasure, that the head sits on top of the spine approximately at the height of the ears. Most people think that it's a little bit further down. So this is where the head sits on top of the spine. And research has shown that we have an image, an idea of where important joints are, and we move according to that. And if it's a faulty image, then we do a faulty, harmful movement. And most people think that it's further down. And so when they put their head down, they seem to bend somewhere around here or further down. And the joints below this height are not designed for prolonged bending. And in fact, even at this point, this is the atlanto-occipital joint or the nodding joint. That's where the head can look down and look up. Now, what is really important for everyone to know is that the freedom to look down is only 10 degrees.
Oh,
Okay?
10
Okay,
degrees.
exactly.
Wow.
I can see the shock. Everyone is shocked. Now, given that our patient is down there, and most clinicians will do this kind of bending, they're using joints. So all the way below, so this is where the head sits on top of the spine. Then at C1, C2, we can look left and right. And then below that, every single joint is a gliding or a plane joint. Now, I can twist and bend and do all this movement because I can squash, squeeze, and distort the disc between the vertebrae. And that's okay if I'm dancing in movement. I keep coming back to neutral. The trouble is that when we bend these joints for lengthy periods, hour after hour, patient after patient, day after day in dentistry, we are doing long-term trauma to the squeeze, distorted, squash this. And that's when we get into trouble. So that's the first thing that is really important to know. And there is no way that a clinician can sit upright and hope to look into a patient's mouth down there, given that there's only a 10-degree freedom, without doing spinal trauma. And that's what
Yeah.
most people are doing.
Sorry to interrupt, Aniko. Just for those who will be listening to just the podcast audio, I will upload this on YouTube so you can all see the visuals, and I highly recommend that you watch it because it's really interesting. But where Aniko had her hands just indicating where the head is to the spine was about sort of mid-ear level, but
Yeah.
highly
And
recommend YouTube.
oh, well, thank you. For the people who are listening to just the audio before they see it, an imaginary rod between the ears is about the axis of rotation for the head to look up and down.
Thank you.
And yes, so please ask me anytime if I'm not explaining something clearly enough or if we need to say anything more for those who are just listening.
Will do.
Now, the only time that clinicians can sit upright and see into the patient's mouth without harmful spinal bending is if they are using an operating microscope or refractive loupes, which are like a mini microscope. And that goes into, I think you were interested in that question. And unfortunately, even when clinicians are using the refractive loupes, I often see them twisting to the side, even though they shouldn't have to. And
I do
before I
that well.
forget, everyone does that. And in fact, just so I don't forget, a very important message I have is this. Please do not be locked into a particular position like most dentists I know sit in 12, 11 o'clock or 12 o'clock position and they don't move around. You're sitting on casters, on a stool that can move. Move your stool, ask the patient to move, turn to the side. Do not twist and bend your spine. And I really hope that everyone will see what I'm going to do now. This is a bendy ruler that I use for teaching. And when we do the usual twisting to the side, we're doing this to our spine. And it hurts me to do it to the ruler. And that's what we're doing. So it's no wonder that most of our colleagues are suffering neck and back pain, as well as shoulder pain for what I talked about before. So coming back to how to sit, if someone is not using loupes, no loupes of any kind, or using conventional loupes, not refractive loupes, and if they are using loupes, provided there is adequate declination, and this is one of the problems, Emma, that I came across about 6 years ago or so, is I started looking at clinicians wearing their loupes. Back then we didn't have refractive loupes, and I found that almost all the loupes that I checked, the mounting of the magnification part was not with sufficient declination, which means that you can't see properly. You have to bend your spine, but provided you have, and it's about 45-degree declination with conventional loupes or no loupes, what is necessary is to pivot the whole torso forward, pivoting forward slightly at the hip joints. Now, most people don't know where their hip joints are. So as you're sitting there, Emma, and anyone listening, if you look down as you're sitting and there's a line or a fold where the torso meets the thighs. If you look at the inside and outside of your thigh and find the midpoint of that line, that's where the hip joint is. Most people think it's further out. Okay, so it's quite a long way in. Exactly.
It is.
Exactly. I know. So this is called updating your body map, correcting where you think your joints are, because guess when our body map is formed? When we're little children playing with Barbie dolls, toy soldiers, and teddy bears, and they don't have anatomically correct joints. So knowing where the important joints are, not all the other joints, just the important ones, is essential. So without doing anything to your torso, you simply pivot forward slightly at the hip joint, just slightly, and then you've got that 10-degree freedom to look down without loupes or with loupes, provided the conventional loupes have sufficient declination. And unfortunately, many of the designers and manufacturers of loupes don't know that there's only 10-degree freedom. I've tried to educate many of them.
Wow, that's really handy to know. Goodness. It's not very far. It's not very far, though, is it? So if you had incorrect declination, you'd still be causing yourself quite a bit of strain.
Oh, absolutely. Because, and I've worked there, I always check clinicians' loupes. And what happens is if there is insufficient declination, they have to bend their neck using those plain joints, gliding joints that are not designed for lengthy bending. And as a result, a lot of clinicians have either already had cervical surgery around C67, because that's where they're bending forward. And also they bend forward to look at computers. So what we do in the clinic, we often do away from the clinic.
Oh no, so we get double on top of that. It's no good.
No, and while I'm at it, I just don't want to miss this. Even before students get into the student clinic or dentists go into the clinic, they spend a lot of time looking down at mobile phones, taking the head down to the mobile phone. is doing this. So the cervical spine has a forward curve. So this is front and back. And what we're doing is forcing it the other way. And that's very damaging. A lot of young people around the world are having cervical surgeries who are not even in dentistry just from that. So what you want to do is, and this is something else I teach, is use the correct joint. We have a wonderful hinge joint called the elbow. You bring the phone to you. You do not take your head down to the phone. This is one of the big reasons why young clinicians are in more trouble than the older generation, because we didn't grow
Yeah.
up with mobile phones. And I want to recommend a device where you can stand your mobile phone up, so you're not tempted to take your head down to
Oh,
see if
that's
you've got
cool.
messages. And you can get variations of this at $2 shops, Office Works, anywhere.
Yeah, you see it everywhere now on public transport. I
Yes,
walk to work, so you see people, standing at the tram stops, neck down into their
yes,
phone.
yes,
It's going to be a real problem. Well, it already is a huge problem, and
it
even more
is.
so for us with our work.
I've got some incredible news for you all. You can now purchase ergonomic loupes at a more affordable price point because my friends at Byron Medical, where I bought my ergo loupes, are now offering payment plans with a further 30% deposit option. And you guys know the biggest game changer for my well-being at work has definitely been my ergo loupes. So if you're currently thinking about it, don't be like me and wait for years to be another dental professional statistic. I've had mine for almost a year now and I have zero regrets, and the team is really responsive, and the quality for the price point, you guys will not regret it. And for my loyal podcast listeners, if you mention you heard about these loupes from Emma Talks Teeth, they will also throw in a treat that you won't want to miss out on. So for all your Admatech products, contact Byron Medical here in Australia. Their team is wonderful and you will love working with ergo loupes.
Exactly. So that's, and something I just would like to bring into our conversation is the power of habit. Whatever you have done a few times, it's like software in the brain, and it's like that's how we do it. So you've always looked down at your patients like this, twisted to the dominant side, or always look down at your phone, taking your head down. Then the second you think of looking into the patient's mouth or looking onto the phone, you're going to do the old thing because that's the software you're carrying. And in order to change that, first of all, you need to be aware of harmful habits. And that's a very harmful habit away from the clinic. And unless people can become aware of harmful habits away from the clinic and change it, there's no way you can change a harmful work posture habit when you've got your patient, you've got complex treatment, and of course, you've got the clock and time pressure. So I always teach people, you need to be mindful how you do whatever it is that you do. Once you know that certain things your body wasn't meant to do, if you're going to hold it or keep repeating it, because that's cumulative trauma on your body.
Well, lots of food for thought there, Aniko. Thank you so much. And coming off you speaking about loupes and refractive loupes, conventional loupes, what are your top equipment recommendations for clinicians to invest in to help us in clinic with our posture, preventing injury?
Well, I'm glad you asked me this. So I made a division in ergonomics. Everything that's not you, not the clinician, I call outer ergonomics. And inner ergonomics, how you do whatever you do inside of you, organizing yourself from the inside out, knowing where important joints are and how to do what you do in ways that's not harmful, I call inner ergonomics. And that's where I'll focus on. However, I have gone into the outer ergonomics. So are you asking me big questions like what kind of dental chair, or more the smaller outer ergonomic items? Because I can talk about all of that, including dental stools are very important. So would you like me to mention everything?
Yeah, that would be great to hear about conventional versus ergonomic loupes as well, would be great. And I think operated chairs would be a handy one to know as well.
Okay. So I call loupes and dental stools an inner and outer ergonomic interface, because You are either sitting on it or you're wearing it, and they have to be right. And for the most part, they're not. So loupes, with conventional loupes, so that's non-refractive loupes, there are very few loupes I know of where I can be certain of the 45-degree declination. And I think surgical might be one of the very few that I think can manage it. Most of them fall short. And with the refractive loupes, so they're called ergonomic loupes, I've looked into Edmetec, which is provided by Byron Medical in Australia, and also Brian Dental refractive loupes. And both of them are found to be excellent. And what's important also with these is how you're measured up and the customer service. And each of them at separate times have asked me, by the way, I've got no involvement with any company. I want to be totally independent and free to critique everything and anything. And
Beautiful.
I've trained the whole team that looks after Australia, both Byron Medical distributing Edmetec and also Brian Dental. And I trained their teams to understand some of the things we're talking about and how to measure up. And what's really important for your audience to know is that if they're being measured up for any kind of loop, it's very important that they don't have the chair too low. You want to be able to you don't want to have your knees locked in, because if you do, and often I see far too long working distance, and then if you're locked in, you are going to be forced to twist to your right or left instead of gliding the chair around. So I've trained both teams, and they have shown to me that they are very keen to get things right, and they'll do anything to make sure it's right. So those are the two at the moment that I would recommend from both quality and also after service customer care, which is important.
Wonderful.
When it comes to, and also people should only be measured up in a dental surgery with a dental chair and a person in the chair. I often see people buying and being measured up at expos, holding a plaster cast up in the air where that isn't where the patient is. So I don't recommend any of that. This is a really important purchase. And often people look for some cheapie online. You want to be properly measured up. This is not where you want to be saving, because that's one of your most important purchases. The other is the dental stool. The dental stool, the seat needs to be firm, not soft, because you need to sit on your sit bones. If you reach underneath as you're sitting, and any of the audience when they listen, and you can feel the bottom of the W of the pelvis, that's what you want to be sitting on. On a soft stool, you just slide off the sit bones. And also, when you're sitting, the sit bones need firmness. It's like when you're standing, if you're standing on some soft quicksand type surface, you don't feel properly balanced. You need a firm, when you're sitting, your sit bones are almost like your feet. And it should be firm. And also it's great to have a slightly forward sloping but non-slippery surface, very slightly forward sloping, because the hip joint should be slightly higher than the knees. Just slightly. The old ergonomic guidelines said that your thigh should be parallel to the floor.
Parallel.
That's no longer the case. The legs need to be released onto the floor. And this is another important message I want to say. The feet need to be on the floor. In the surgery, when you're sitting on the couch, anywhere, because if you are crossing your legs or tucking your legs in under the floor or doing anything else with your legs other than having your heels underneath your knees, then you're asking the movement muscles of your lower back to start firing to help manage the weight of the legs. And they're not designed for lengthy contraction.
I'm uncrossing my legs now.
Okay. I was a chronic leg crosser and I had massive hip issues. Now what happens is, and this is coming back to the power of habit, you have a software called This Is How We Sit, and your leg will automatically cross over. So whenever you notice it uncross, and after a while, you will delete that software and you'll have a new, more optimal default that doesn't have you crossing your legs.
I need to do that. This is me.
I had to. I had to. And also the knees should be not together. So we learned as young women that to sit ladylike, where you have your thighs together. The design of the leg is such that when you're sitting, you know how guys take up so much room when they sit on an aeroplane seat next to you? That's the design of the legs in sitting. Not ladylike at all, but that's how you're meant to sit. I used to have my knees together like this. And then it means that, again, movement muscles are holding it there, but you don't even notice it because you've always done it. So my message is, ladies, sit unladylike, and you cannot wear a miniskirt.
And I guess another good question to ask is, like we spoke about earlier, I mean, we get a little bit of ergonomic training in school, but there's so much theory to get around, so it's no proper ergonomic training. Should dental professionals be doing specialized CPD when they graduate? Is that something that everyone should look into?
Oh, very much. If I had known just a fraction of what we talk about today, even in this short time we have together, I would not have suffered for decades the way I did. And in fact, what I'm teaching, I call the user guide, or the user guide for dental work posture. I mean, everything we buy these days comes with a user guide. Imagine if we actually got that, something where we learned, and this is what I teach, what to do and not to do with your spine, what to do and not to do with the shoulder and elbow, so that you have a long quality career and life. Because
I would have
the
loved
pain,
that years ago.
now it's never too late. I came across it later in my life, and it's never too late. So I highly recommend it. And I've often given short workshops, training, lectures at various dental schools. And the faculties just about everywhere know that they need it. They just don't seem to be able to find the time to fit it into the busy curriculum. So given that, and I'm hoping that at one point it will be part of the dental training for all clinicians, given that right now it isn't, I highly recommend that young graduates learn how to sit well. And also I teach those that stand, especially clinicians who stand up for extraction or special needs. There is a way to stand where you don't do damage to your back. And I also teach how to do extraction so that you're not hurting your arm. You're actually using the power of your hips and legs, because that's where our power base is. So I highly recommend it. And I run training programs, both in person, training studio with a dental chair, so that I can teach, and also I'll be able to do that online. But I go out to dental practices. I used to run courses and workshops in dental showrooms. I still do in Brisbane. So I recommend it, because this is the way to reduce the risk of occupational chronic pain, which is very high. And you probably know this, Emma, the incidence of occupational chronic pain for neck, back, and shoulder is higher for dental hygienists than it is for dentists. Did you know that?
This is true. Yes, I did know that. It is, yeah, I guess a lot of us work on our own as well. We're often the team member of, out of the dentists and hygienists that get, left alone if we're short-staffed and having to suction for ourselves. So that really doesn't surprise me at all when I first heard that.
That's what I think as well. And you need to have a dental assistant. And if you don't, I recommend that you hand the patient a slow speed suction and get them to hold it. And it's a good way to get them involved, because you want to be able to hold. I believe that there is some gadget that may not be available yet, that I think Byron Medical is trying to introduce. It's called the Ergo Finger, where you can hold. Have you heard of this?
I have, yes. I have tried it.
Oh, you have tried it. Is it available yet, or did you just try it at an expo?
I've just tried it, and they did give me a few to take into clinic. I think they have launched it. I think it is available now.
Oh, good, because when I last spoke to them, they were waiting for approval from the TGA. And anyway, that allows you to hold the mirror and the suction tip, and also a
So
curved
clever.
suction tip. Yes. In fact, that's something else I highly recommend, that nobody uses the straight suction tip for high-speed suction with the sharp end. A curved, rounded end is much kinder, and you don't have to raise your elbow as much if you're using a curve, because with a suction tip. And while I remember, have you come across double-sided mirrors?
I do use them.
Good. I recommend it to everybody.
They're great.
They're great. Now, you know, when they come into their own, when you are working in quadrant 3 buckle, because with just one side, if you wanted to retract and see, you would have to do that, whereas you can turn it and then it's right. Same
So
in
good.
quadrant 4 lingual. You are way ahead of most people. Most people have never heard of it. Well done, Emma.
I try. Oh, well, my boss is very on top of everything like that as well. So very lucky.
You are very lucky. If we have time, one more thing I'd like to say about stools is that I find most clinicians who are sitting on saddle stools are sitting too high. The way to tell or to calibrate what height to sit at is to find the height at which your hip joints are still a fraction higher than the knee. However, the heel of your foot must be all the way down in the shoe, because quite often I see that when they're sitting up high, the shoe itself is on the floor, but the heel inside the shoe is actually slightly up, and the weight is on the toes. And then what happens is that you're not giving the full weight of your legs, and each leg weighs at least 12 kilos. You need to release that onto the floor. Otherwise, again, the lower back movement muscles have to start firing and contracting.
So many things to retrain ourselves in. Even I'm thinking, I need to do this and I need to do this. Because we all have areas we need to improve, right?
Well, it's not about improving, and I just want to say that it's no one's fault. If you hadn't been taught all the things that we've been talking about, and this is just touching the surface because there's a lot more to it. I actually teach what's called directional thinking, where you're thinking in directions, vector fashion, to release certain muscles and joints and various things. So there's a lot more to it. But even just what we spoke about, it's not common knowledge. After graduating from various dental institutions and training schools. So I just want to take any blame, shame away from anyone, because often dentists have said to me, oh, how could I not know? Well, if you don't know, you don't know. We have never learned. And just to say, well, now I can start working on some of my harmful habits, because a lot of habits are great, but there are certain postural habits and movement habits we have that are doing us harm. And literally everything we do in the clinic, we do it to some degree away from the clinic. And you want to pick it up away from the clinic and change it first, so that you can then change it in the clinic.
Yes. No, definitely see that value there. Well, what would be your final take-home message you want to leave with our listeners today?
Take care of yourself. You are your most precious instrument, and you only have one precious spine. We seem to focus on everything, and often we practice as if we're a disembodied pair of eyes, hands, and brain, and the thing in between, which is our body, somehow is a black hole. So take a look at, how am I doing whatever I'm doing? If you're sitting at your kitchen table or dining room table and you're hunched over to reach for the salt, stop, use your hip joints to come forward and then reach for it. If you can begin to do things like that, or stop, in fact, ask for support, because habit is so strong. If you have been taking your head down to the phone, ask the people you live with and work with, just say, I want to break this habit. If you see me with my head down towards the mobile phone or whatever device, please come up to me. And I do this. I get permission in my courses and I go like this and they go, oh, sorry, Aniko. And I say, don't be sorry. It's not you. The habit is doing you. So if you can notice, and that means mindfulness, and then have the motivation to break that habit, then you can do something well. And there's one more I really would like to squeeze into the little bit of time. I see a lot of people text with their thumbs. I'm just making sure you can see it, and also scroll. Now, the thumb is not the same as your fingers. It's got one left joint and it's designed for that. It's not designed for doing that. So I recommend that you hold the phone and scroll like this and text like that. And when I say this, people go, oh, Aniko, that's so old-fashioned. My mom does that. I say, well, do you want a
Use the
long
index
career?
finger.
Exactly. Because I know a number of dentists who had to stop working because they have inflammation from doing that. So if you want a long career and good life, not suffering pain, you might want to slow down with your scrolling and texting. And again, change habits. And then once you're more able to notice what you're doing and how you do what you do, because if you just do something any old way, away from the clinic, you'll do the same in the clinic. Hurry, look at the clock, oh, got to rush. You are more important than the clock. So that's
Agreed.
my very big message.
Agreed 100%. Well, thank you so much for your time today, Aniko. What is the best way to reach you if anyone has any questions or wants to learn more about the courses they can go to?
OptimumDentalPosture.com. So you can look up my website. I am about to put up some more information, but that's the way to contact me. And I will have a lot of workshops and courses available in Melbourne, also online. And for people who want to go to a Brisbane workshop, I have one scheduled later in the year. So, and people are welcome to ask me questions. I'm frequently contacted by people who have never done anything with me and may never do. And I'll answer questions. I'll guide them about stools and loupes. I'm here to help because I don't want anyone to suffer the way I used to. And that's what drives me, Emma.
I love that, Aniko. Thank you so much for sharing your passion with us today. And I really appreciate you sharing some gems with us.
Oh, it's been a pleasure and lovely to meet you. And I wish you and the audience all the very best.
Thank you so much. I'm just going to stop that here.